I think a lot of people don't realize the impact that your oral health can have on your overall health. You know, we tend to forget that we're one person and everything is connected. And, you know, one of the biggest things is heart disease. You know, when infections stay for a long time, they can travel anywhere. You know, like I said, it's all connected. I think a lot of the times people stay away because they think that, you know, either we're going to cause them harm or pain, which is probably one of the biggest reasons, but then they also are afraid of being judged. They're afraid of having to come up with whatever explanation for why they stayed away for so long. But when you're in my chair, the most important thing for me is how can I help you get to where you want to be? Whatever happened before, the second you sat in my chair, that doesn't really matter, except the things that we have caused what you have. I can help you understand it and educate you for how we got here, but we're not going to stay here. The second you sit in my chair, it's about solutions, right? So when you come to a dentist's office, typically we're not here to judge. We're trained to help you understand how you got to where you are, but really we're more focused on getting you healthy now and helping you develop habits to keep you healthy in the future. One thing that I realized, especially moving to a state like Maine where, you know, access to care is really limited, brushing and flossing is not that obvious, and I hate for us to make that assumption and really reduce it to that, but that is what it is. We really need to develop that habit and that discipline of being consistent with our oral health care routine. I think a lot of the times you fall asleep and say, oh, it's going to be okay, I didn't brush my teeth tonight. No, that matters. You know, and I think I almost tell my patients to almost get obsessive about flossing, you know, like, oh my goodness, I feel sleepy, but I can't go to sleep because I have to floss. Like, be that severe and be that dedicated to that, you know. And if it's something that you haven't grown up around and it hasn't been something, set yourself a challenge. 7 days. In 7 days, can I brush my teeth twice a day and floss once, just for 7 days? You know, if you can do that and then you kind of keep pushing that over and over and over, you may develop that habit of doing it every day. But if you can't brush twice a day, which we want you to, at least brush right before you go to bed. Like, that is the most important brushing that you definitely don't want to skip. One of the biggest things is swelling. Right? You see swelling, you need to run to the dentist. I know most of the people go to the emergency room. No, you need to try to get to your dentist right away. At least if you do go to the emergency room, get on some antibiotics to make sure that we don't get that progressing, right? Anytime you have any sensitivity to sweets, that's a sign of a cavity immediately, right? When you have pain from sweets, you have a cavity, period. There's no going around that. You need a fill-in, right? Hopefully that's all you do need. But the second you start to feel throbbing, sort of like a heartbeat, like boom, 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 we're talking infection, right? And you really want to get that taken care of before it becomes something bigger. And a lot of the times, if you've had a tooth that's been hurting you for a long time, then it stops, then it comes back, and then it stops, and then it's been several months and there's nothing, there's a high likelihood that that tooth is now dead. So the next time you get any sort of symptoms from that tooth, it won't be pain. It'll be your face turned into a basketball. And one of the things that most people don't really realize is that it's more affordable than you think. It gets more expensive the more that we put things aside, but the earlier you come and the earlier we are able to intervene, it's probably more affordable.